Mesothelioma is a type of cancer that develops from the thin layer of tissue that covers many of the internal organs known as the mesothelium. The most common area affected is the lining of the lungs and chest wall. Less commonly the lining of the abdomen and rarely the sac surrounding the heart, or the sac surrounding the testis may be affected. Signs and symptoms of mesothelioma may include shortness of breath due to fluid around the lung, a swollen abdomen, chest wall pain, cough, feeling tired, and weight loss. These symptoms typically come on slowly. Greater than 80% of mesothelioma is caused by exposure to asbestos. The greater the exposure, the greater the risk. As of 2013, about 125 million people have been exposed to asbestos at work. High rates of disease occur in people who mine asbestos, produce products from asbestos, work with asbestos products, live with asbestos workers, or work in buildings containing asbestos. Often it takes around 40 years for the disease to begin. Washing the clothing of someone who worked with asbestos also increases the risk. Other risk factors include genetics and infection with the simian virus 40. The diagnosis may be suspected based on chest X-ray and CT scan findings, and is confirmed by either examining fluid produced by the cancer or by a tissue biopsy of the cancer. Prevention centers around reducing exposure to asbestos. Treatment often includes surgery, radiation therapy, and chemotherapy. A procedure known as pleurodesis, which involves using substances such as talc to scar together the pleura, may be used to prevent more fluid from building up around the lungs. Chemotherapy often includes the medications cisplatin and pemetrexed. The percentage of people that survive 5 years following diagnosis is on average 8% in the United States. In 2013, about 50,000 people had mesothelioma and 34,000 died from the disease. Rates of mesothelioma vary in different areas of the world. Rates are higher in Australia and Great Britain and lower in Japan. It occurs in about 3,000 people per year in the United States. It occurs more often in males than females. Rates of disease have increased since the 1950s. Diagnosis typically occurs after the age of 65 and most deaths occur around 70 years old. The disease was rare before the commercial use of asbestos. Signs and symptoms, or SIG, of mesothelioma may not appear until 20 to 50 years, or more, after exposure to asbestos. Shortness of breath, cough, and pain in the chest due to an accumulation of fluid in the pleural space, pleural effusion, are often symptoms of pleural mesothelioma. The most common symptoms of peritoneal mesothelioma are abdominal swelling and pain due to ascites, a buildup of fluid in the abdominal cavity. Other features may include weight loss, fever, night sweats, poor appetite, vomiting, constipation, and umbilical hernia. If the cancer has spread beyond the mesothelium to other parts of the body, symptoms may include pain, trouble swallowing, or swelling of the neck or face. These symptoms may be caused by mesothelioma or by other, less serious conditions. Mesothelioma that affects the pleura can cause these signs and symptoms. Chest wall pain. Pleural effusion, or fluid surrounding the lung. Shortness of breath. Fatigue or anemia. Wheezing, hoarseness, or cough. Blood in the sputum, fluid, coughed up, hemoptysis. In severe cases, the person may have many tumor masses. The individual may develop a pneumothorax, or collapse of the lung. The disease may metastasize, or spread to other parts of the body. Citation needed. Tumors that affect the abdominal cavity often do not cause symptoms until they are at a late stage. Symptoms include abdominal pain, ascites, or an abnormal buildup of fluid in the abdomen, a mass in the abdomen, problems with bowel function, weight loss. In severe cases of the disease, the following signs and symptoms may be present. Blood clots in the veins, which may cause thrombophlebitis. Disseminated intravascular coagulation, a disorder causing severe bleeding in many body organs. Jaundice, or yellowing of the eyes and skin. Low blood sugar level. Pleural effusion. Pulmonary emboli, or blood clots in the arteries of the lungs. Severe ascites. A mesothelioma does not usually spread to the bone, brain, or adrenal glands. Pleural tumors are usually found only on one side of the lungs. Pericardial mesothelioma is not well characterized, but observed cases have included cardiac symptoms, specifically constrictive pericarditis, heart failure, pulmonary embolism, and cardiac tamponade. They have also included nonspecific symptoms, including substernal chest pain, orthopnea, shortness of breath when lying flat, and cough. These symptoms are caused by the tumor encasing or infiltrating the heart. Cause. Working with asbestos is the most common risk factor for mesothelioma. In the United States, asbestos is considered the major cause of malignant mesothelioma and has been considered indisputably associated with the development of mesothelioma. Indeed, the relationship between asbestos and mesothelioma is so strong that many consider mesothelioma a signal or sentinel tumor. A history of asbestos exposure exists in most cases. However, mesothelioma has been reported in some individuals without any known exposure to asbestos. In rare cases, mesothelioma has also been associated with irradiation of the chest or abdomen, intrapleural thorium dioxide, thyrotrast, as a contrast medium, and inhalation of other fibrous silicates, such as areonite or talc. Some studies suggest that simian virus 40, SV40, may act as a cofactor in the development of mesothelioma. This has been confirmed in animal studies, but studies in humans are inconclusive. Pericardial mesothelioma may not be associated with asbestos exposure. Asbestos was known in antiquity, but it was not mined and widely used commercially until the late 19th century. Its use greatly increased during World War II. Since the early 1940s, millions of American workers have been exposed to asbestos dust. Initially, the risks associated with asbestos exposure were not publicly known. However, an increased risk of developing mesothelioma was later found among naval personnel, e.g., Navy, Marine Corps, and Coast Guard, shipyard workers, people who work in asbestos mines and mills, producers of asbestos products, workers in the heating and construction industries, and other tradespeople. Today, the official position of the U.S. Occupational Safety and Health Administration, OSHA, and the U.S. EPA is that protections and permissible exposure limits required by U.S. regulations, while adequate to prevent most asbestos-related non-malignant disease, are not adequate to prevent or protect against asbestos-related cancers such as mesothelioma. Likewise, the British government's Health and Safety Executive, House, states formally that any threshold for exposure to asbestos must be at a very low level, and it is widely agreed that if any such threshold does exist at all, then it cannot currently be quantified. For practical purposes, therefore, House assumes that no such safe threshold exists. Others have noted as well that there is no evidence of a threshold level below which there is no risk of mesothelioma. There appears to be a linear, dose-response relationship, with increasing dose producing increasing disease. Nevertheless, mesothelioma may be related to brief, low-level, or indirect exposures to asbestos. The dose necessary for effect appears to be lower for asbestos-induced mesothelioma than for pulmonary asbestosis or lung cancer. Again, there is no known safe level of exposure to asbestos as it relates to increased risk of mesothelioma. The duration of exposure to asbestos causing mesothelioma can be short. For example, cases of mesothelioma have been documented with only 1-3 months of exposure. People who work with asbestos wear personal protective equipment to lower their risk of exposure. Latency, the time from first exposure to manifestation of disease, is prolonged in the case of mesothelioma. It is virtually never less than 15 years and peaks at 30-40 years. In a review of occupationally related mesothelioma cases, the median latency was 32 years. Based upon the data from PETO et al., the risk of mesothelioma appears to increase to the third or fourth power from first exposure. Environmental exposures. Incidence of mesothelioma has been found to be higher in populations living near naturally occurring asbestos. People can be exposed to naturally occurring asbestos in areas where mining or road construction is occurring, or when asbestos-containing rock is naturally weathered. Another common route of exposure is through asbestos-containing soil, which is used to whitewash, plaster, and roof houses in Greece. In central Cappadocia, Turkey, mesothelioma was causing 50% of all deaths in three small villages: Tuzkoy, Karayan, and Sarıhidar. Initially, this was attributed to areonite. Environmental exposure to asbestos has caused mesothelioma in places other than Turkey, including Corsica, Greece, Cyprus, China, and California. In Metsovo, this exposure had resulted in mesothelioma incidence around 300 times more than expected in asbestos-free populations and was associated with very frequent pleural calcification known as Metsovo lung. The documented presence of asbestos fibers in water supplies and food products has fostered concerns about the possible impact of long-term and, as yet, unknown exposure of the general population to these fibers. Exposure to talc is also a risk factor for mesothelioma. Exposure can affect those who live near talc mines, work in talc mines, or work in talc mills. Pathophysiology. The mesothelium consists of a single layer of flattened to cuboidal cells forming the epithelial lining of the serous cavities of the body, including the peritoneal, pericardial, and pleural cavities. Deposition of asbestos fibers in the parenchyma of the lung may result in the penetration of the visceral pleura, from where the fiber can then be carried to the pleural surface, thus leading to the development of malignant mesothelial plagues. The processes leading to the development of peritoneal mesothelioma remain unresolved, although it has been proposed that asbestos fibers from the lung are transported to the abdomen and associated organs via the lymphatic system. Additionally, asbestos fibers may be deposited in the gut after ingestion of sputum contaminated with asbestos fibers. Pleural contamination with asbestos or other mineral fibers has been shown to cause cancer. Long thin asbestos fibers, blue asbestos, amphibole fibers, are more potent carcinogens than feathery fibers, chrysotile or white asbestos fibers. However, there is now evidence that smaller particles may be more dangerous than the larger fibers. They remain suspended in the air where they can be inhaled, and may penetrate more easily and deeper into the lungs. We probably will find out a lot more about the health aspects of asbestos from the World Trade Center attack, unfortunately, said Dr. Alan Feen, Chief of Pulmonary and Critical Care Medicine at North Shore Long Island Jewish Health System. Mesothelioma development in rats has been demonstrated following intrapleural inoculation of phosphorylated chrysotile fibers. It has been suggested that in humans, transport of fibers to the pleura is critical to the pathogenesis of mesothelioma. This is supported by the observed recruitment of significant numbers of macrophages and other cells of the immune system to localized lesions of accumulated asbestos fibers in the pleural and peritoneal cavities of rats. These lesions continued to attract and accumulate macrophages as the disease progressed, and cellular changes within the lesion culminated in a morphologically malignant tumor. Experimental evidence suggests that asbestos acts as a complete carcinogen, with the development of mesothelioma occurring in sequential stages of initiation and promotion. The molecular mechanisms underlying the malignant transformation of normal mesothelial cells by asbestos fibers remain unclear despite the demonstration of its oncogenic capabilities. See next but one paragraph. However, complete in vitro transformation of normal human mesothelial cells to malignant phenotype following exposure to asbestos fibers has not yet been achieved. In general, asbestos fibers are thought to act through direct physical interactions with the cells of the mesothelium in conjunction with indirect effects following interaction with inflammatory cells such as macrophages. Analysis of the interactions between asbestos fibers and DNA has shown that phagocytosed fibers are able to make contact with chromosomes, often adhering to the chromatin fibers or becoming entangled within the chromosome. This contact between the asbestos fiber and the chromosomes or structural proteins of the spindle apparatus can induce complex abnormalities. The most common abnormality is monosomy of chromosome 22. Other frequent abnormalities include structural rearrangement of 1p, 3p, 9p, and 6q chromosome arms.